Hello, everyone. Welcome to the third episode of Careers in Care, a podcast designed to provide more information about careers in health and healthcare administration. I'm Praneeth Saja.
I'm Aman Modi.
And I'm Meghna Burgess.
And we are Cure for Care, a project aiming to help raise awareness about and develop careers related to healthcare administration. With us today, we have Reese Niemitz, a student studying healthcare administration/management and healthcare law at the University of Texas at Austin, to discuss the healthcare administration industry and share his own experience. Good evening, Reese. Thank you for spending your valuable time to be a guest with us today.
Reese, can you introduce yourself and tell us a bit more about what you study at UT Austin?
Hi, yes. My name is Reese. I'm a sophomore at the University of Texas at Austin. There I study, I'm currently in the Canadian Field Business Honors Program there, studying marketing, but also specializing in healthcare administration and industry reform. While I'm over there, I'm involved in a lot of consulting work. So I consult with a lot of small businesses through a bunch of student organizations. And then I also I've done work outside of that through internships with digital marketing specifically, taken numerous classes in healthcare, both examining it from a sociological perspective and how health kind of permeates throughout society, but also in more of a law setting as well, and an administration capacity. Yeah.
Okay, that's amazing. Reese, what inspired you to pursue a major in healthcare administration? Did you always know that this was the field you wanted to pursue?
Yeah. So one of the things that really there's like some feedback. I don't know where it's coming from. One of the reasons I got inspired to going into healthcare was because there's a huge healthcare crisis in the United States. I think it's something that every year we spend about $3 trillion, or about 20% of our GDP. Can't remember the exact figure of it, but off the top of my head, but a significant amount of our GDP on healthcare. And there's no really reason to, because when you look at other industrialized nations that are comparable to the United States, like Sweden and Norway, they spend far less on healthcare per capita, but they still have better health outcomes. So there's definitely something wrong that's going on, primarily in a systematic way of how our healthcare is structured. And so that was really one of the reasons why I wanted to get involved in studying healthcare, because we're supposed to be one of the richest nations on earth, and yet we have some of the worst poor health outcomes. It's like even mortality. There's like some non-industrialized nations that have better mortality rates for mothers than we do, which is quite shocking to hear about. So I really became involved so I can learn more, one, about how the system works, because I feel like not too many people know about how it works on a logistical, systematic level. They know a lot about the science behind being a doctor, and know a lot about in politics, but not how it works as an industry, and to help be a part of that change to make it work for everyone.
Right. This trend can be seen clearly through the death rates of the United States. We almost crossed 2.5 million deaths in the United States, and it clearly shows that our healthcare administration has failed to some extent.
Mm-hmm. No, definitely. It's even like also when you look across like race, for example, like Black women in the United States, whenever it comes time for mothers to be giving birth, they die at rates that are like 2 to 3 times higher than Asian American and white women in the country. So there's also this definitely a racial divide too in health outcomes, and there's just a lot of pinpoints to focus on why that is, and some of it even spans beyond what we think health is. Like if you go to Europe, for example, how they view health is not just within the hospital. We in America typically have a view of that healthcare exists only within clinics and surgery rooms and things like that. But a lot of the factors that influence what leads you to a hospital happen outside of the hospital, like your diet, where you live, things like that. And so that's one of the reasons why we have such a high death rate and such a disproportionate death rate among like racial groups, because we typically view, and this is why having a sociological perspective in healthcare is really important, but typically view health as only in those confines, and really if you want to make the largest impact on people's health and minimizing the gaps and within our own racial groups inside our country, also between us and other industrial nations, that happens outside of the hospital system.
Yeah, definitely. In our own research, we found like one of the major issues was that the U.S.'s healthcare system was very fragmented, and there's definitely a lot of ways to improve it. So
yeah.
So
I was just going to add a little anecdote about how one of the interesting things too about our healthcare system is that we bill for individual services. So like we have billing codes to assign for getting a single ibuprofen pill. But in other cases, in other countries, what they do is they bill for a treatment. So like whenever you go with a broken arm, they don't bill you for each, like each time they change your bandage or something like that. They bill for the entirety of treating it. And so there's a lot of optimization and efficiency they have there, which that kind of leads itself to all the fragmentation, both within like how doctors are sometimes treated as contractors in the hospitals. They're responsible for billing. They bill independent treatment and services when oftentimes there's a lineage between while you're first in the hospital and the care you receive afterwards and even future illnesses.
Mm-hmm. So you basically wanted to get into healthcare administration to like help be part of the change and learn more about how we can fix our broken healthcare system.
Mm-hmm. Yeah.
So on top of that, like what were like some of the activities or like how did you come across this research or passion for healthcare administration?
Mm-hmm. Yeah, that's a very good question. A lot of it was just conversations, you have with your friends about healthcare, and also this is something you see a lot of people talk about on social media, especially within the realm of political activism. You see like things like Medicare for all and universal healthcare. But it's interesting because most people who talk about these proponents don't even know how Medicare works, for example. And so I knew that I didn't know how Medicare works. So it's kind of, I can't really talk about that subject really well when I don't know how that welfare program is administered in the country. And so that's one of the reasons why I started getting interested into the research, so I can, be an informed citizen about the issues that we try to talk about. And that led me to start taking some of their classes too. And one of the first classes I took at UT was healthcare law. And I was taught by a professor who is actually one of the pioneers of healthcare law, and or in terms of just integrating law within the healthcare system, because there's actually just a certain type of hospital that's being created now, and it's being more widely adopted. It's called legal medical services, I think is the name of it. But basically is where they have lawyers on staff at a hospital to help with, oftentimes like if people can't get their Medicaid payments, but they are entitled to Medicaid, it helps them kind of sort through those efforts in order to get the things that they need to help get access to healthcare. Anyway, so that was a really interesting class I took, and she was a phenomenal speaker, and she knew so much about so many different things. And hearing about her experience has been pretty remarkable, and it's one of the most fulfilling classes I've taken. Also, one of the most challenging classes I've taken, because you read so much court cases and court opinions about health and healthcare and how the legal system views that. And so, I kind of just been researching more about that and trying to get involved everywhere I can, even in my own, like the consulting organization I'm part of on campus. One of the clients that we're consulting for is a healthcare startup that specializes in helping patients take their medicine, being reminded to take their pills, because that's a really important factor, and a large proportion of people don't actually follow their prescription plans. But two, also getting pharmacies to know if their patients are or not taking the prescription, because then you can help notify doctors and things like that, and help rectify some of those preventable conditions that can arise from not following a prescription plan.
Right. So I think social media and internet played a huge role in making you aware about the current system and how healthcare administration really works. That's very insightful thought from you. So moving forward, what skills did you learn from these activities? And these activities could be something that you could have been a part of in your colleges since you're sophomores. And what were some of the key takeaways from these activities?
Mm-hmm. Yeah, I mean, a lot of it, part of it's like, quarantine, with it being a very virtual setting. A lot of it has to be explored in a non-physical way. I can't be in an actual hospital working with those kind of people. But and really the large part of it is just kind of all the law. I mean, that's been going around healthcare, especially with even COVID-19. There's been a whole bunch of court cases about liability protection and how that affects health outcomes and the incentives it gives doctors. But one of the things I think is really important to know is that the future of health will be shaped primarily through law, as it's always been. Typically, there's been court cases that have established standards of care, not even really the American Medical Association or anything like that. It's always been, or the American Heart Association. They come out every year and they talk about what their new standard guidelines for treating hypertension is. But most doctors don't even actually adhere to that, which is quite remarkable. And so it's always law that kind of is the one that, you have to follow the law, otherwise you get in trouble, and they kind of enforce some of that behavior. And so I think, the challenges of our healthcare system will probably have to be remedied through either one, policy making, through like through legislative bodies within states and across states, but also within the courts themselves. So and some of it isn't even that like the law itself is wrong. It's just that people don't even know about the law and they don't know how to like exercise when they're denied the benefits granted them by the law. And so really just giving people access to those legal services can really have a tremendous impact for some of our poorest communities in getting access to healthcare and Medicaid.
Yeah, that's really fascinating because like even us, like even though we like researched healthcare administration, we didn't really like come across much information about healthcare law.
Mm-hmm.
And like to hear you talk about how impactful it is and like how like
Mm-hmm.
it kind of dominates the other aspects of healthcare administration.
Mm-hmm.
I feel like yeah, that's a very good topic to touch upon and learn about as if
Mm-hmm.
you want to pursue a career in healthcare administration.
Yeah, no, it definitely is very much true. There's actually a program that was created. I can't remember which president was underneath, but it was basically legal aid, and it was having attorneys that would go out to all the different states, and they were providing pro bono work because they were reimbursed from the government, the federal government, but they basically help provide legal services to the residents. And so you notice that the states that have the worst Medicaid and Medicare coverage, which are typically the states that did not follow the Affordable Care Act, are also the states that have the highest rates of uninsured people of healthcare, and they also have the lowest usage of the legal aid services. So there's definitely a high correlation between a lot of these different factors, and it's really interesting to see that some of the worst health outcomes come from the states that willingly choose not to expand Medicaid and Medicare. And so that's one of the reasons why when we look at law, there's a bunch of one, just political debates to go about how we tackle our healthcare system because like, for example, the Supreme Court ruled that you can't force states to expand Medicaid and Medicare and through the Affordable Care Act. And so one of the interesting things, though, is that the majority of uninsured people live in the states that legally voted to not expand Medicaid and Medicare. And so if the Supreme Court ruled that you can't, force states to adopt this, then it kind of raises the question about the viability of like a Medicare for all universal healthcare system. That would be some really significant legislation that has to be passed and almost would probably have to be through an amendment at this point. But then there's the question that if these states don't want Medicare expansion through the Affordable Care Act, what makes you think they would want Medicare for all or universal health care? And if they don't want that, then like it's like the states like California that have some of the highest rates of insured people are fighting for people in Texas who aren't their own states who are saying they don't even want health insurance. So it's a very contentious and just a really just deeply convoluted feel of this work to get through to in order to address these health outcomes because they exist. It's just the answer is not as clear as I think people try to make it seem.
Yeah, there's like a lot of legal battles that we have to fight
Mm-hmm.
to get into the actual improving of healthcare administration.
Mm-hmm.
It definitely seems like a very confusing field, or at least a very multifaceted field. Do you have any advice for someone who might be wanting to enter this profession or field?
Mm-hmm. Yeah, really the biggest advice is just to start reading. And one, don't trust everything you see on social media, which should be a given for anything you want to do. But if you're particularly interested in healthcare, there's a lot of misinformation online. But really, especially in healthcare administration, like there's so much law around just how you treat people and patient confidentiality, for example, HIPAA. Like that's always an ever-changing body of law with new rules that are being proposed and passed. And so really being able to do a lot of reading about that kind of work because, when you're a director at a hospital, you have to know, what is allowed legally and what's not allowed. Otherwise, you would get sued, and that's a lot of money to pay when you're an institution. And so really getting on top of like some of the legal climate of healthcare, reading court cases whenever they come out and, the significant ones that affect maybe your jurisdiction, for example. Local politics, too, do have a huge impact. And also just getting involved too with the community factors that shape health. I think one of the things that is interesting about what Seton is doing is they're trying to become more involved in their community. I think there's something like I'm not going to give a number off the top of my head because I don't remember it, but it's a significant amount of money they're donating to providing charity care, and also just providing money for improving the community around them because East Austin, for example, has some of the highest rates of poverty in the country, and Austin is the most economically segregated city in the nation. And so undoubtedly, we have some of the most varied health outcomes between people who live in the poorest parts of Austin, which also happen to be Hispanic and Black Americans, and the rich part of Austin, which happens to be to the west and predominantly white. And so they're starting to invest a lot of their resources into improving those communities that are built on unsafe housing that oftentimes causes asthma problems because it's filled with asbestos and not proper insulation and just different things like that. So being involved in community factors and being able to help like champion and advocate within your own organization, whether you're a director or you're just an accountant for a hospital, is really important. Important work to make community change, and then also the legal status and understanding the climate that can help with understanding how to make a national or statewide change.
Yes, it seems like a lot of information to take in.
Mhm.
And so I know that people who want to study healthcare administration may be initially daunted by the wide variety of the information that they have to take in, and there might be some other challenges. So like, what do you personally recommend for those students who want to overcome those challenges?
Well, just with the sheer volume of information, I mean, I definitely know that. I mean, again, I had to read 40 cases just for a single course that I had to take. And I think one of the biggest things you can do is try to find online resources. Like I think Coursera has plenty of courses you can take for free. I mean, you'll audit them. You're not going to earn a certificate or an online degree. Don't recommend earning an online degree to begin with, but you can take those and they can start segmenting it for you to help organize information, because law itself is hard for a place to start. It's hard to really know even where to go find the appropriate information, or even how to understand like judicial analysis or reasoning. And so if you're not able to take a course through your university about just understanding law, period, trying to find something online to replicate that is definitely important. So you can start filtering through some of those legal texts. And then you can find like landmark healthcare cases and start reading through those and understanding like how healthcare is, it was shaped from the law that happened, starting all the way from back in the early 1900s onwards. It's a pretty difficult question because I think it's also just dependent on like what school you go to and how that professor chooses to teach it. Because law itself, like if you go to Yale, they teach law quite a bit differently than how Harvard teaches it versus how Stanford teaches it. And so my professor, she went to Harvard for her law degree, and I think she even taught at Harvard for a bit. And so she was very influenced by some of like the way they approach law, and it's very case study focused, which most law schools are. But she also has a different doctrine of belief when it comes to healthcare law, and some schools typically are more conservative and more textual based when it comes to interpreting law, and other ones tend to be more loose and liberal with the law. And so that's also just going to depend on what cases your professor might choose to pull for you, or what they put forward as the foundation for legal analysis. But yeah, I would recommend trying to find some course that can help you understand like just the legal system as a whole. Because one, that's important to understand how it works, and then how it can give you some legal framework for analyzing court opinions.
So it seems that the majority is just maybe varying your resources and maybe looking outside of your course to get a better base understanding of healthcare administration.
Mhm.
So that's useful in a general sense, but one thing that's especially brought the healthcare administration career field into the spotlight is obviously the COVID-19 pandemic. So what role do you think healthcare administrators play in being prepared for these types of medical crises? And how do you think we can be better prepared as a nation?
Yeah, I mean, that's a really good question. I think also when we look at the pandemic, there's obviously the epidemiological perspective, which is just the virus itself spreading throughout communities, throughout the nation, across the globe. But really, when we look at how cases are transmitting and how they're affecting proportions or populations at different proportions, for example, Black and Hispanic Americans in Austin are getting it more likely than white Americans are, and they're dying more often than white Americans are. And so when we look at kind of just some of the more devastating effects of the virus, we kind of look at like our community factors, the same things that are, the reason why Black mothers have a higher mortality rate than white mothers. Like the same factors are kind of things that are pushing the the viruses have uneven effects on these different populations. So really what the pandemic has done for healthcare administration is it kind of just put the things we kind of already knew before, things that were dismissed by some of the larger healthcare associations as not relevant. It kind of put them as a forefront and, made some companies have to come to reckoning that these are definitely factors that come to play. And even public health institutions like Austin Public Health, like we knew that Black Americans, for example, were more likely to be in the service sector and sort of in-person jobs that can't be replicated online, like professional services jobs can. But we've never thought to think about how that might have an impact on health until we had a pandemic, which makes sense because the pandemic is not a very common occurrence, and it's definitely something that's always talked about. But it really has just brought to light things that have already happened, and being prepared for the future is understanding that one, what are the things that are causing this systematic inequality, which kind of has already been some of the legal work to begin with and some of the more community-oriented view of healthcare. But really pushing for that now, because I think now with healthcare as such a forefront of like the news all the time and just people's daily lives, they're kind of being forced to realize how unequal everything is. And I'm hoping that would be a push forward towards some real lawmaking, some real change. And so I think healthcare administrators specifically have to be aware of the role in helping to help with this uneven community access to healthcare and other factors too. Um, It'll be interesting to say though. I mean, I can't predict the future. I don't even know when the virus will end. I mean, we can even see that with the vaccine rollout. I mean, the healthcare administrators some of them were optimistic and some of them weren't. And it seems like the ones who weren't optimistic were the right ones. But um, it would be difficult to say how that progresses, but I have a feeling that I hope that it will be a positive change forward towards some of those more equitable solutions for healthcare access and how we handle community factors of health.
Yeah, okay. Thank you so much for that informative answer. So another thing I wanted to ask you was, how has healthcare as an industry or career evolved over the years? And how do you think healthcare will continue to grow in the future?
Mm-hmm. Yeah, no, that's a really good question because when we look at our healthcare industry now, when it's very consolidated into these very large hospital networks, it didn't used to always be that way. It used to be very church-focused administration of health. And like, for example, if you look at a lot of the prominent hospitals like St. David's, they have a lot of religious affiliation, but now they're no longer really just tied to a church. And so a while ago, it used to be in these one-off churches that would serve the poor, um, charity care, things like that. Um, and so that's how it used to be. It used to be very fragmented. There used to be like your local physician you would go down to and pay $20 for a checkup. It was very like mom and pop, almost like a cottage industry, but with physicists, or not physicists, physicians themselves. Um, and so one of the downsides of that kind of industry is that you don't have consolidation of resources, right? Nowadays, if we had only local doctor's offices, I mean, we're going to go for your like treatment of cancer. I mean, it's not like your local doctor's office is going to have the drugs needed to treat for you to undergo chemotherapy as much as like a large hospital network would be able to move those resources around. And so what we started seeing over the years was people started transitioning out of this charity care, religiously affiliated hospital work and towards more like businesses oriented work. They started getting boards of directors, which, once you have a board, you start having stakeholders and you start becoming a little bit more concerned about becoming a business and becoming about making a profit. And so you start seeing like these businesses start to arise, particularly around the 20th century. And then they started consolidating, which as most industries do, once they get to a point where they're really big, companies will start to consolidate. And you can see that throughout the 20th century as a whole. That's basically one of the landmarks of that century in terms of business. And then now that's what we're left with is these really large hospital networks like Extension, for example. They're massive. And when you don't have those large hospital networks, you typically have university-based teaching centers, like Johns Hopkins, for example, Harvard Medical School. And so those are really like the predominant places you have. And then you have like local regional clinics like Austin Regional Clinic, but they don't really have the services you would go for like an open heart surgery. You would go to like an extension hospital for those kind of things. And then because we have these networks, that's kind of how health insurance has kind of evolved. Is because when you have like when you have this large company like Extension, they have multiple hospitals. You can go on as an insurance and say, I have these pool people that I'm insuring. Can I negotiate a rate with you? They have leverage over the hospital networks, and so because of that, they work out a deal. They get some better rates for their people, and that's how the insurance company pays for those things. But then it kind of disenfranchises the people who don't have insurance because they're not in on that deal, where it ultimately benefits the people who have that private insurance. Um, so yeah, that's kind of how it's evolved, and mainly because of the consolidation of healthcare, which again has brought really great things for just allocating resources and being able to have these really robust medical procedures that we have now. But at the same time, it has made price and accessibility such a huge problem that we didn't really have before.
Yeah, that definitely that was great insights behind what administration is and what really works around it. So, right, last question of the day. So, do you have anything to say to middle schoolers and high schoolers who are starting to look at career options?
Mhm.
People like it, especially my family, would the one of the options we consider in medical field is just a doctor. So,
Mhm.
why do you think they should pursue healthcare administration?
Mhm. Yeah, I think for I when I was younger, one, I wanted to be a veterinarian. I didn't like the idea of putting down a cat. That was always pretty traumatic to me. But I always knew I wanted to help people, and I knew I wanted to do it in like a really intimate capacity that you could, like with a doctor, right? A doctor and patient relationship is one of the most intimate forms you can have in the business world. Unfortunately, I don't like the idea of surgery too well, so I didn't think that was going to be too good. And then general physician work didn't really appeal to me too much. So I really thought how I can make an impact on there, coupled with also just understanding the healthcare industry is pretty broken as it is. But there's many ways that you can still have that element where you can help improve people's lives through that doctor-patient relationship that's special, but almost like working behind the scenes of it in a way, right? Like not everyone can be that doctor who's going out interacting with that patient, who's conducting the surgery. There has to be people who have to run the logistics behind it. Whether or not that healthcare company is private or public, there still has to be administration behind it. And oftentimes the administration is what gives the scale of that impact. So you have the individual doctors who are the ones who actually do the treatment and stuff, which is invaluable work of itself. Nothing can replace that. But you have to have some coordination that can only really be done by administration. I thought that's where my skill set, as a person who is typically analytical but also more strategy driven, where I could have lied. So if you find yourself wanting to make an impact through an industry like healthcare, which it is very intimate and does impact people's lives in the most profound ways, but you're not necessarily don't want to go into the realm of actually having to do surgery or go through all the schooling that's needed to become a doctor and all the training. Healthcare administration is a good balance between the two, and it's still a stable career, and you still get to have you get to help make a change in the world, which I think is the most meaningful thing that you can do in a career.
Yeah, those are all very good points about why you should consider careers in healthcare administration because you really can really impact the health of millions of people. Although it might not be like directly, as you said, like behind the scenes is very important as well. And so that's it for today. Thank you again, Reese, for all the very detailed and passionate responses to all of our questions. Um, yeah, we definitely learned a lot today. I learned a lot today, especially about healthcare law and how it affects healthcare administration. So for all those who are listening, thank you and see you next time.